that I call Reds and Oranges Part 2 or Part 1, depending on if you looked at the other lower arch or this is the upper arch. And if you watch the bottom one, there's a lot of reds and oranges in the bone characteristics. In particular, let me just go through that real quick, and please look at the lower if you're interested in this case. But this is one of those miracle cases that I would say don't even start. So bone density is a red, facial bone is red, bone constriction is orange, detached gingiva is orange, if not probably red on the upper. Sinus bone is a red, IA nerve position is orange, bone characteristics is red, and ridge height is also an orange, but it's pretty much a red on the upper. There's not a lot to go on here. So from time to time you get cases like this that patients start to resorb more and more bone as they get older, and they have dentures that just don't work, and you know another reline is not going to help them. And so what do? You send them away, or you send them to somebody that you think might be able to help them. This is one of those unfortunate cases where I basically told the patient that I can't help them, that they're essentially a dental cripple at this point. All the bone has gone away, but also they don't have a capacity to grow adequate or dense bone, and the anatomy also hinders greatly in these cases. She can look into sinus lifts and things like that, but if she's not, in my opinion, if she's not able to generate her own bone or give some sort of density to the bone in the first place, meaning have the capacity to grow the bone, then I'm kind of reluctant to even get her into doing grafts. If there's an oral surgeon that wants to do autogenous grafts or has growth factor type stuff or anything that they think that they can enhance the bone growth, go for it. But that's not going to, I don't want to restore it, and I don't want to do the surgery on it either. And so they would have to find somebody else to do that. I step away on everything, because when you do the prosthetic on a case that somebody did the surgical, then you're kind of stuck with their work and your work now stuck together. So I'm not a big fan of that. Let's look at the CT. We're going to look at the upper right. Here you can just see right in that molar area just how hollow it really is. There just is nothing there to work with in this hard cortical bone area. Sure, you got a Schneiderian membrane, but the capacity for that bone to help generate bone within your graft is very difficult. So you do need some sort of autogenous grafting or some sort of growth factor type of osteogenic type of material here to help grow that and enhance the growth of that. It's going to take a very long time to try to grow some sort of density into that area. As we go more anterior, we're into the premolar, but look at that knife edge. This is definitely one of those problems when the teeth were extracted and the teeth were out here, and that facial plate just completely collapses away. It's not the lingual wall that's changed so much, but it really comes into how that upper arch just cannot do much. Unfortunately, here's where you get some decent bone here, maybe a little bit better. But we're so in the anterior now, you probably wouldn't even want the implants really so much there, but it's so knife edge, you're not going to get anywhere with that. And if you can't get something here, don't waste your time with something there. Let's look at this upper left side here, and you're going to also see even worse scenario. I don't know if you've watched the other videos that I do. There is one that I call a sinus step, and so see the anatomy here kind of just scoops down like a big bowl. Here's where you have like a stepwise scenario. So there is this funny little step that we see, and it just really doesn't help this patient at all. Look at how this bone kind of comes across here, and this is where the maxillary sinus comes in. It just engulfs right into any possibility of bone in that premolar, canine premolar sites. You just don't have any hope for anything here. It's just all hollow. And that's just an unfortunate event for the patient. There is nothing that's really going to help this scenario except massive grafts and massive hope or what I call miracles to happen that this patient is going to come out successful. It's going to take a very long time, even if you do try to do that, to try to get that in there. You know, this is where, if there's oral surgeons watching, that please pipe in, write something in the comments for us, and add to a discussion around this one, because this patient, I just basically told her that I would have to pass on her case, as well as anybody else. This is one of those cases that I think is pretty much hopeless, but maybe she'll find somebody that wants to try something. I particularly don't like to give people too much of a sense of success when the success is very, very low, you know, even when I tell them. At some point I draw the line. So, and I don't want to work on the prosthetic here, so I don't really care about doing the relines. I let other people do that, and there really isn't much else this patient could do, so unfortunately they're kind of stuck. So that's about it. So thanks for joining, and like us on Facebook and subscribe to us on YouTube. And join us for live broadcasts. They come and go. I'll be here talking and be looking at people's comments and such and such, blah, 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 blah. So it's always fun to have more people pipe in on some of these case studies and just keep talking. So thank you very much. Thanks for joining, and got something out of it.